Altitude. The first time I met Dr. Kai Nakamura, I was landing a Boeing 737 with a cardiac emergency in the cabin and a growing pain in my own chest that I couldn't afford to acknowledge because 180 people's lives depended on me staying conscious and focused. I didn't know his name yet, didn't know anything except that I was Marcus Reid, 29, captain of United Flight 447 from San Francisco to Denver, and my left arm was starting to hurt in a way that made my survival instinct scream that something was very wrong. The flight had been smooth. That's the thing about commercial aviation. Most of the time it's boring. Takeoff, climb to cruise altitude, maintain 35,000 feet, manage fuel consumption, monitor systems, prepare for descent. It's technical, methodical, designed so that nothing surprises you, except surprises happen anyway. At 2:47 p.m., somewhere over the Sierra Nevada mountains, my first officer, a woman named Chen who'd been flying with me for 3 years, told me we had a passenger in distress. Cabin crew reports chest pain, difficulty breathing, consciousness fading, she said, her voice carefully neutral in that way pilots use when we're about to coordinate an emergency. Male, approximately 72 years old. No medical alert in his records. Have them start basic life support, I said immediately. Get a medical professional if we have one aboard, and get me current weather and landing options. The pain in my chest sharpened. I ignored it. Denver Air Traffic Control came online within seconds. United 447, we have your medical emergency logged. Current weather in Denver is visual. Winds from the northeast at 12 knots. Runway 35 right is clear. Recommend descent immediately. We'll give you priority approach. Copy that, I said. Beginning descent now. A voice crackled over the call button. Male, young, calm. This is Dr. Kai Nakamura. I'm a flight surgeon. The passenger is in acute cardiac distress. I'm starting CPR, but I need to know our time to landing. 75 minutes, I said, beginning the descent protocol. We're 95 miles out, descending from 35,000 feet. What do you need from the flight deck? A stable platform and the fastest possible landing, he said. I can do basic life support, but he needs a defibrillator, IV access, and hospital-grade cardiac monitoring. I'm doing what I can, but you'll have all of that in 75 minutes, I promised. Maintain CPR. We're on the way. I should have told him something else. Should have told him that my left arm was now actively hurting, that my chest felt tight in a way that made breathing difficult, that I was having trouble focusing on the instruments because there was a specific kind of pain that gets your attention. Instead, I flew. The descent is when you realize how much the human body isn't designed for altitude. The pressure changes, the oxygen levels shifting, the sudden awareness that you're actively falling toward the ground at a controlled rate. Most people don't notice it. They're focused on their phones, their conversations, the in-flight beverage service. But pilots notice everything. Marcus, Chen said quietly, looking at me sideways the way pilots do when they're assessing whether their captain is okay. You good? Fine, I lied. Talk me through our landing window. We descended through 20,000 feet. The pain was spreading now. Up my neck, into my jaw. That specific radiating quality that made every part of my training scream that I was having a cardiac event. At 35,000 feet with 180 people aboard, I couldn't afford a cardiac event. Marcus, I'm fine, I said more firmly, already radioing Denver. United 447 requesting priority landing. Patient in acute cardiac distress. ETA 12 minutes. Copy, United 447. You're cleared for direct approach, runway 35 right. Emergency services standing by. 10,000 feet. The pain was becoming difficult to hide. My hands were steady on the controls. Muscle memory, training. The specific ability pilots have to compartmentalize panic while everything else in your body is screaming. But Chen knew something was wrong because we'd flown together for 3 years, and she could read me the way I could read an instrument panel. Marcus, you're pale. What's happening? Passenger emergency is my focus right now, I said. We land, we get that gentleman to the hospital, then we talk about it. You're having chest pain, she said flatly. It wasn't a question. Landing this plane is my job. Your job is keeping this plane and these people safe, which includes keeping yourself safe, Chen said. If you're having a cardiac event, I'm landing this plane, I said. You can call for medical services when we're on the ground. 5,000 feet. We were approaching Denver, the city sprawling out beneath us, the airport coming into view, everything I'd trained for 12 years of flying for. The technical moment where you transition from being an aircraft at altitude to being a vehicle that needs to land precisely on a specific runway. United 447, you're looking good, Denver ATC said. Cleared to land, runway 35 right, emergency services are standing by. Copy, I said, beginning final approach. The landing was textbook perfect, which is how I knew I was having a serious cardiac event, because I was flying with perfect precision while my body was actively failing. Muscle memory? Training. The specific way a pilot's brain works when everything matters and you can't afford to make mistakes. We touched down at 220 miles per hour, then dropped to landing speed, descended from the runway, started taxiing toward the emergency bay where ambulances were already waiting. Good landing, Chen said, which was her way of saying that was skilled flying despite the fact that you're probably dying. Thanks, I managed. Take the rest of the flight. I'm going to go meet with the passenger and the doctor. I should have gone directly to the paramedics. Instead, I walked to the cabin where a man in a Navy uniform, a man I'd just potentially saved by maintaining consciousness for 75 minutes while having a cardiac episode, was being transferred to a gurney by emergency responders. And standing next to him, covered in the passenger's blood, was the most beautiful man I'd ever seen. He was Asian, probably late 20s, with dark eyes that held the specific exhaustion of someone who'd just fought for another person's life in a confined space. He had blood on his hands and face, and he was talking rapid fire to the paramedics about vital signs and medications and everything I should have been paying attention to but couldn't, because the pain in my chest was now spreading into a tightness that made breathing difficult. You, the man said, looking at me, you're the pilot? Marcus Reid, I managed, and you're the doctor who... The cabin tilted. Not actually tilted, but my balance suddenly became questionable, and the beautiful doctor was moving toward me with professional concern. You're having chest pain, he said. Not a question. Sit down, now. I need to... Sit down, he said more firmly, already reaching for me. What's your name? Marcus, and I'm fine. You're not fine. You're pale, you're sweating, you're displaying acute cardiac distress, and you're trying to hide it like a pilot. He got me into a jump seat, was already checking my pulse, my pupils, my oxygen saturation with a portable device he'd apparently had in his medical kit. I'm Dr. Kai Nakamura. When did the pain start? During descent, I admitted, but I had a plane to land. You had a plane to land, and a cardiac event, Kai said flatly, which means you landed a Boeing 737 with 180 people aboard while having a possible myocardial infarction. That's either the bravest or the dumbest thing I've ever heard. The plane needed landing. The plane had another captain, Kai said. Your first officer could have taken over, but instead you decided saving other people's lives was more important than not dying yourself. The paramedics were already loading the original patient onto an ambulance. Kai gestured and they came back with a second gurney. I don't need a gurney. You absolutely need a gurney, Kai said. Get on. We're going to Swedish Medical Center right now and we're getting an EKG, cardiac markers, and a full workup. And you're going to tell me everything about your medical history while we're en route. I got on the gurney, partly because my chest was starting to feel like it was being crushed by something very heavy, partly because Kai Nakamura had the kind of commanding presence that made you want to obey him, partly because I realized in the moment of handing control over to someone else that I'd been terrified. The ambulance ride took 15 minutes. In that time, Kai established IV access, did a portable EKG, started talking to the hospital via radio about my symptoms, my history, my family's medical background. 12 years flying, he asked, taking my blood pressure, since I was 17. High-stress job. I love it, I said. The flying, the responsibility, the technical precision, I love all of it. Your heart might not love it, Kai said. You're 30 years old and you just had a cardiac event at 35,000 feet. I'm 29. You're going to be 30 within the year, and you're going to be lucky to be here to see it. He was working while he talked. professional but not unkind. What was your family history? Any cardiac events? Father had a minor heart attack at 55. Mother is fine, no siblings. So you have genetic predisposition plus the stress of commercial aviation, Kai said. That's a bad combination. We arrived at Swedish Medical Center's emergency department. Everything after that was a blur of EKGs, cardiac markers, a cardiologist who looked at my test results and said the words myocardial infarction very carefully, as if they would hurt less if pronounced slowly. I'd had a heart attack. A minor one, but a real one, at 35,000 feet. While landing a plane, I spent 2 days in the cardiac unit at Swedish Medical Center. Kai came by both days, not as my doctor, that was a cardiologist, but as someone who apparently wanted to make sure I understood exactly how close I'd come to dying while flying a commercial aircraft. You could have lost consciousness, he said on day 2, sitting in the chair next to my hospital bed. You could have had an arrhythmia that made you incapable of landing the plane. You could have died, and you would have taken 180 people with you. I didn't, because you got lucky, because your first officer was competent, because you made it to the ground before the cardiac damage became severe enough to incapacitate you. He leaned forward. You can't fly anymore. Your medical certificate is revoked pending review, and you're not going to pass that review. Your career as a pilot is over. It felt like he'd taken my heart, the non-cardiac part, and crushed it. I've been flying since I was 17, I said quietly. It's all I know how to do. Then you're going to learn to do something else, Kai said, not unkindly, because the alternative is you having another cardiac event in the flight deck and killing a lot of innocent people. Why are you being so harsh? Because you need someone to be. He stood up. Because I watched you land a plane while having a heart attack, and that was the most terrifying and impressive thing I've ever seen, and I'm furious with you for risking your life like that. It's my life to risk, not when 180 people are aboard, Kai said, and not when the person you're risking has someone waiting to find out he's okay. Does he? I asked. Does someone care? Kai softened, just slightly. Yeah, I do. I care. Because you landed that plane while dying, and you asked about my patient before you asked for medical help, and I haven't stopped thinking about you since. He left before I could respond. Left me in a hospital bed, cardiac damaged and grounded, with the sudden realization that I'd met someone extraordinary in the worst possible circumstances. I was discharged on day 3 with prescriptions, restrictions, and a cardiology follow-up scheduled. The Federal Aviation Administration came by on day 4 to inform me that my medical certificate was suspended pending a full cardiac evaluation, and that I should not operate any aircraft until cleared. Kai didn't come back until day 5. I thought you weren't coming, I said when he appeared in my doorway. I wasn't going to, he said. But I realized that being noble and staying away from you wasn't actually noble, it was cowardly. So I'm here to ask, if your career in aviation is over, and you need to find a new direction, would you consider getting coffee with the flight surgeon who helped save your life? That's the worst pickup line I've ever heard. I know. But you landed a plane while having a myocardial infarction, so I figured you had low standards for dramatic situations. I laughed, actually laughed, which the cardiologist had said I should avoid due to chest pain. It was worth the pain. There's a cafe in the hospital, I said. I could probably walk there if you held my arm. I can do that. The cafe was small and quiet, tucked into a corner of the hospital where visitors and patients and hospital staff all mingled. We got coffee, decaf for me because apparently my cardiac medication made caffeine a poor choice, and sat in a corner booth. Tell me about flying, Kai said, before the cardiac event, when you were just flying and not dying. So I did. I told him about learning to fly at 17, getting my commercial license at 21, moving through regional airlines until I made captain at 29. I told him about the specific joy of taking off, the technical precision of flight, the responsibility of 180 lives trusting you to keep them safe. I loved it, I said. I can't imagine doing anything else. You're going to have to, Kai said gently. Your heart can't handle the stress. But that doesn't mean your career is over. It means your aviation career is over. You could do something else with that technical mind, that sense of responsibility. You could be something other than a pilot and still be essential. Like what? I don't know yet, but I'd like to figure it out with you. He reached across the table, took my hand. His fingers were warm, and his touch made my newly fragile heart skip in a way that felt dangerous and perfect. I'm going to be a disaster to date, I said. I'm grieving my career. I'm on cardiac medication. I probably need to go to therapy. All of which sounds like you're a human being who's been through something traumatic and is processing it, Kai said. I'm not asking you to be stable. I'm asking you to let me know you, to let me help you figure out what comes next. Why? You barely know me. I know you well enough, Kai said. I know you can land a plane while having a heart attack. I know you asked about your passenger before yourself. I know you're terrified about your future, but you're still smiling. That's enough for me. The next 4 weeks were strange in the best way. Kai had arranged for me to talk to a therapist who specialized in pilot transition. What happens when pilots lose their medical certification and have to rebuild their identity? I started cardiac rehabilitation, 3 days a week of monitored exercise and education about managing post-MI recovery, and I spent every evening with Kai. We'd meet at restaurants near the hospital where he worked, or at my apartment where I was doing my rehabilitation exercises. He'd cook dinner, Vietnamese food, specializing in dishes his parents had taught him, while I sat on his counter and told him about the specific grief of losing the only career I'd ever wanted. My father wanted me to be a doctor, I said one night, watching him make pho from scratch. I wanted to fly. He said I was wasting my potential. Flying to him was something people did when they didn't have better options. Your father was wrong, Kai said. Being a pilot requires incredible discipline, technical skill, and the ability to make life or death decisions under pressure. That's not wasting potential. That's maximizing it. Was, I said. Past tense. I'm not a pilot anymore. You're grounded, not dead, Kai said. You're still the same person. You still have the same mind, the same skills. You just need to apply them to something other than commercial aviation. Like what? I don't know, but I know someone in aviation consulting who might. I know the FAA has regulatory positions that need people who understand flight operations. I know there are 1,000 things a skilled pilot could do besides fly commercially. He set a bowl of pho in front of me. You just have to be willing to imagine yourself doing them. By the 6-week mark, I was certified clear for normal activity. The cardiologist said my heart was healing well. My cardiac medication was working. I could return to almost normal life, just not to flying. Come with me somewhere, Kai said one evening. Not to the hospital, not to a restaurant, not to your apartment, somewhere that scares you. What kind of somewhere? You'll see. He drove me to Rocky Mountain National Park, parking at a trailhead I'd never noticed before. We started hiking. Not difficult, not strenuous, but upward into the mountains. Your father said flying was wasting potential, Kai said as we walked. What would he say about hiking? He'd say it was pointless exercise. Is it? No, it's... I stopped at an overlook, looking out at the mountains stretching in every direction. It's beautiful. It's peaceful. It's being part of something larger than myself. That's flying too, isn't it? Kai asked. That feeling of being part of something larger? Yeah, it is. Then maybe your next career is about finding that feeling in different places. He took my hand. Maybe it's about being essential to something other than keeping a plane in the air. We sat on a rock overlooking the mountains, and Kai kissed me. Gentle, careful, aware that my heart was still fragile, still healing, still learning how to love something other than flying. I love you, he said. I know it's fast. I know we met under traumatic circumstances, but I watched you land a plane while dying, and I fell in love with you then. And I've spent the last month finding all the reasons why that was the right choice. I love you too, I said, even though you grounded my flying career. You grounded your own flying career, Kai corrected. Your heart just made it official. 3 months later, I took a job with aviation safety consulting, a firm that helps airlines optimize operations and safety procedures. The job uses everything I learned as a pilot: technical knowledge, safety thinking, the ability to understand complex systems, but doesn't require me to fly. It's not the same as being a commercial pilot, but it's essential work, and it's work I can do with Kai. He works nights at Swedish Medical Center's emergency department. I work days at aviation safety consulting. We see each other in the mornings before he sleeps, in the evenings before he works, on his days off when we do normal couples things. Hiking, cooking, sitting on my balcony talking about the future. "Have you thought about going back to school?" Kai asked one evening. "You could study aeronautical engineering. You have the background. You have the mind for it." "I've thought about it," I admitted. "But that's 4 years of school while starting a new career." "You're 29, Kai said. "In 4 years you'll be 33. You're going to be 33 either way. Might as well be 33 with an engineering degree. You're very logical about my future." "I'm very invested in your future," Kai corrected. "Because my future includes you, and I want both our futures to be exactly what we want them to be." I applied to the University of Colorado's Aeronautical Engineering program. I was accepted with a scholarship based on my professional aviation background. I started school in the fall while keeping my consulting job part-time. It was exhausting. It was exactly what I needed. Epilogue. 1 year later, December, Rocky Mountain National Park, the same trailhead where Kai first took me after I'd lost my flying career. But this time, I'm taking him. We hike to the same overlook, the same rock where he kissed me and told me he loved me. The mountains are covered in snow, and the view is crystalline clear. "Why are we here?" Kai asks. I take his hand. "Because this is where you help me understand that losing one thing doesn't mean losing everything. Because this is where you told me that my potential wasn't wasted, just redirected. Because this is where I fell in love with you." I get down on one knee, carefully because my heart is still carefully monitored, but I'm strong enough to do this. "Dr. Kai Nakamura, you saved my life 3 times. Once in the emergency department when you got me medical care. Once when you told me my flying career wasn't my entire identity. And once when you kissed me on this rock and made me believe in a future that wasn't the one I'd planned." I pull out a ring, brushed titanium, matching his taste and his professional aesthetic. "Will you marry me?" He's crying, and he's laughing, and he's pulling me up and into his arms. "Yes," he says. "Yes. Always. Yes." We stand there on the overlook, engaged, in love, 2 people who met at 35,000 feet in crisis and landed together in something beautiful. "I love you," Kai says. "I love you too," I reply, "even though you grounded me." "Especially because I grounded you," he smiles. "That's when your real life started." We walk down the mountain together, planning a future that includes his work in emergency medicine, my studies in aeronautical engineering, a life built on the foundation of that impossible moment when I landed a plane while having a heart attack and met the person I was going to spend forever with. Sometimes the best things in life come from the moments when everything falls apart. Sometimes losing one dream leads you to a better one. Sometimes meeting someone in crisis means you're meeting someone who understands what really matters. We mattered. We still matter. And we're going to keep mattering. That's not a bad love story. That's exactly the one we needed.